I need the microphone, Raj. I do need the microphone? I do? All right, good. Well, I think you can see that your goal has been achieved with Dr. Solis, and if you heard one thing that was most important, it's that you've helped train the trainer. And you're going to go back and train at a minimum 2 interventional radiologists. But the part that I don't know how much you caught, but she's going to train the ICU doctors in how to get the access to veins when they otherwise can't. So what practically does that mean? Well, if you've got a child in this hospital that is a cancer patient who is fighting for their lives and is in shock, their blood pressure is so low that their veins collapse. And they may not be able to get into the veins to deliver the drugs they need literally to save the child's life in the intensive care unit. When you're in that situation, if you can't get an IV into the veins, you need to somehow find a vein that's small enough to get into with precision. And Dr. Solis will then teach not just the interventional radiologists, but the intensive care unit doctors how to use some of these techniques. And as she mentioned, she learned one technique, now she has 2 techniques to be able to literally give life-saving treatment access to these kids. So your goals are being achieved, and it's spreading through Spain. It looks like we're going to be moving to possibly the Netherlands for another doctor, and possibly one from Pakistan. But to just give you a little update of some of the progress that your children's hospital, and I say that very specifically because it is your children's hospital, and as you know, it started off as a regional hospital and then a national presence. Well, now it's a world center for treatment that patients cannot find anywhere else. So not only have we achieved the goal for you of making sure that your children and your grandchildren never have to leave Columbus to get the best care in the world, but patients from around the world are now coming to Columbus because they can't get care anywhere else. And what I'd like to share with you is a little extrapolation. I don't know if you noticed in that slide about, and by the way, the Mrs. Doubtfire thing, don't trust anything you hear from these guys. That was all Photoshop. That was really not me in a dress and air balloons. So nice. The Army Colonel does not cross-dress. So where are we going with this business with the chef? And I liked your slide. Did you notice that the chefs wear white garments just like doctors? Well, we put that together, and the discovery, I think we shared this with you before, how we came up with this medical meringue. And the medical meringue literally came out of the kitchen. And the beauty of this technique, and you've asked about this before, and again, one of the big service goals of Rotary is to find service opportunities that can be implemented in any country, developing, underdeveloped, developing countries, etc., with very little financial and capital input. Well, this is one of those things that you can deploy in every hospital, in every country, and it's very inexpensive. And Spain, with their financial crisis, does not have the resources to make sure that you're going to deploy a $10,000 treatment for 100,000 children. So now we're going to give Dr. Solis the opportunity to take medicine, 3 different drugs now, and make it into a meringue for the first time. They don't use this currently, and she'll be taking this back. But this is that drug that they have in their pharmacies. And if you shake this drug, it's really not a drug, it's a protein that's derived from donated blood called albumin. Well, it's the same protein in egg whites, which is why we make meringue from egg whites, because the protein. And if you shake it, you get bubbles. Well, just like the Joy of Cooking says, if you beat it until you have stiff peaks, you're adding more air and you're binding more protein together, and it becomes very stable. If you shake this a lot, the bubbles get very, very small. It turns out that the drugs that Dr. Solis is going to be injecting bind to this protein. So not only is it a good way to see the drug, but it links onto that protein and it stays in place to be released slowly over time. So it's an awesome discovery that's incredibly inexpensive, and we make the medical meringue, as you see here, into this stable foam. And I think we've shown you this, where where we use the meringue to change the color here. The fluid in the eye is coming out yellow. We need to change it to white so we can see what we've treated and what we haven't treated. And again, this is something that Dr. Solis will be able to use in every body part. She may take a few years before she starts working on the eye. And until then, we'll continue to take care of those patients in the eye. We just got another referral yesterday from Italy. We've got one from Hungary. We've got one coming from Africa. We have a 70-year-old man who's already blind in his eye because no one treated him earlier, but he still has pain, and he's coming from Puerto Rico this week for the second treatment. So we're doing the job in this community, not only to care for patients outside, but you're helping us to get these patients treatment so they don't have to come to Columbus for that treatment. And training the trainer is key. So what are we doing that goes beyond children? And this is quite exciting because of, particularly for the women in the audience, but the men who are married to women who may have these painful breast cysts. And we may or may not have talked about this before, but the quick update of how successful this is, these are things that surgeons don't have any treatment options for. They try to cut them out, they come back. And these women have pain every day of their lives, just like this woman, Judith. She had pain since she was since she was 17 and 24 years of pain. But the bottom line is, with the same techniques that Dr. Solis is taking back, and by the way, when you train the trainers, you want to train the adult doctors who can treat the adult women in Spain with their breast cysts, because this is a phenomenal treatment that we didn't talk much about. But here we have this one woman, and she comes from Michigan, and she's got 5 cysts, 1 on the right, 4 on the left, and she just has these tubes under her shirt for 3 days, walking around shopping in Easton and Polaris and going to dinner in Columbus, and then we take those tubes out. But here's the medical meringue. Here's that black cyst, and the next image, you see the needle coming in to that cyst. Here's that little needle inside the cyst. It's going to suck that fluid out, and then the medical meringue inside, and that will kill that cyst. Relieves pain, gives her a whole different life, and it actually gave her the opportunity to have a successful marriage, because on the second round of her marriage, she now is pain-free for 4 years, and she can hug her husband, the second husband, because the first marriage didn't work, partly because she couldn't even roll over in bed without pain, much less hug her husband. So this is a phenomenal, not only an advancement, but it gives you a sense of the progression of what your children's hospital is doing beyond the kids. Now we're stretching into how we can extrapolate discoveries at children's to the adult community. So again, thank you for your support for Dr. Solis and the other doctors in Spain. And it will creep out of Spain. Eventually, Dr. Solis' job is to get this into Portugal. And then you'll help us take care of Pakistan. And we've already done one doctor in India, which is just a beginning. And then we'll get some doctors from China, hopefully shortly. Very interesting challenge getting some of these specialists to support the care. But we're getting there one country at a time, and hopefully at a minimum saving some vision and giving patients the ability to live pain-free. So thank you very much.